Hi, my name is Chase Yako. I work for CANBERRA Corporation, and here at CANBERRA we are very focused on trying to get you as much transparent information as possible so that you can take on the current concerns that are happening all around the country and all around the world as it relates to COVID-19, as well as generally how to properly disinfect. So we hope that you find this very valuable, and we'll get started. There are three topics that we want to discuss today. One is just a glossary of terms. Make sure that you're comfortable with the terminology that's going around and that you would use out as you're talking to customers or to everyday people that you meet. The second is to talk about how to properly remove pathogens, the different ways that you can do that. And then the third is to talk about emerging pathogen compliance as well as the current climate today. So let's get started. The first term that you'll hear a lot of are bacteria. Bacteria, it's good to note, are living organisms. And those single-celled organisms are built with a cell wall for the most part and a nucleus inside. They require food, some require oxygen, and ultimately they are living organisms that are going to continue to eat, excrete, and reproduce. And that excretion is traditionally toxic, that traditionally makes us sick. Now, not all bacteria are pathogenic or are going to get you sick. Some are good for you and exist currently in your stomach today. We're going to focus more on those pathogenic bacteria that we want to remove from surfaces so that we don't get sick. We traditionally break bacteria into two big groups, one being gram-positive and one being gram-negative. Gram-negative having a little bit more of a complex cell wall that's more difficult to kill, while gram-positive are traditionally a little bit easier to kill with a less complex cell wall. Now, some bacteria do have the ability to become spores, and when they become spores, they essentially build out an exterior that's not easily penetrated, which is why very few disinfectants have the ability to have a sporicidal claim. When we're talking about bacteria, we are traditionally talking about killing that organism. Unlike viruses, as we'll talk about later today, viruses don't live. They're not a living organism. Bacteria are. So when we're talking about disinfecting, we're traditionally talking about killing, not inactivation. The next type of microorganism are fungi. These are parasites that require a host cell in order to exist. That could be on animals, plants, or even other fungi. They're very pH sensitive, so a strong cleaner can traditionally help to remove fungus growth. You are traditionally talking about killing that said organism, and some examples of that would be what causes athlete's foot or mildew or mold. Now today we're going to also be talking about viruses, which are the most common discussions as we see today. Viruses would be hepatitis A, hepatitis B, hepatitis C. It would also be norovirus, which is the stomach flu, or influenza A, which is the respiratory flu. The main one that we'll be talking about later is coronavirus, or COVID-19 to be more specific. Viruses are not living organisms. While they do have a cell wall, they are not going to exist without a host cell. What they do is they actually infect that host cell, change the DNA, and then start to mutate. This is consistent with any virus that exists today. We traditionally will categorize viruses by one, an envelope virus. An envelope virus will have a thick, tacky exterior shell that traditionally makes it so that disinfectants can more easily kill that organism. Some examples of that would be HIV, hepatitis B, and the beta coronavirus family that we'll talk about later. The second category of viruses are considered non-enveloped viruses. Non-enveloped viruses are a little bit more difficult to kill. Sometimes they're large, sometimes they're small, but what they don't have is a thick exterior shell, making it more difficult for disinfectants to adhere as well as break into and inactivate the organism. So now we understand that there is a difference between bacteria, fungi, and viruses. Some other common terms would be germs, which are microorganisms that have the ability to get you sick or are considered pathogenic. Another type of term that we traditionally hear are nosocomial infections. These they are acquired while in a healthcare facility. Hospital grade is a common way that we describe disinfectants. In order to be considered applicable for a healthcare environment, you need to be able to prove and the EPA has to confirm that your product can kill Salmonella, Staphylococcus, and Pseudomonas. One-step disinfectant is traditionally described as a product that can both clean and disinfect in one step. The last term that we commonly hear are bloodborne pathogen compliant disinfectants. This is actually a OSHA term that identifies that it can be used in the presence of viruses that are traditionally associated with blood, like HIV and hepatitis B. Now that we understand some terms that are commonly thrown out, we would now like to go into how to actually kill or inactivate those microorganisms. There are 4 key ways that you can do so. 1, proper cleaning. As we mentioned, organisms like fungi can be very pH sensitive, so a heavy-duty cleaner can actually help to do the removal of that pathogen. But also physical cleaning can physically remove the pathogen as well as its food source. That is why we commonly would suggest that you do a thorough job of cleaning in a facility to help prevent outbreaks or the spread of pathogens on hard surfaces. The second type of removal is sanitizing. We'll get into that a little bit later, but sanitizing is a lower level of pathogen removal traditionally associated with food service applications. Disinfecting. Many people associate sanitizing and disinfecting as the same. They are not. Disinfecting requires a higher level of kill than what a sanitizer would require. The last level of pathogen removal or microorganism removal is called sterilizing or sterilization. Sterilants are not commonly used in our environment. They are traditionally used in clean rooms and other facilities. So we won't go heavily into sterilants, but realize they do exist and their purpose is to remove 100% of all organisms on a given surface. Past cleaning, you come to sanitizing. Sanitizing is the removal of 99.9% of pathogens or microorganisms from a surface. This is the common generality that is used, or a 3-log reduction of microorganisms. 99.9 is commonly identified on hand sanitizers as well as surface sanitizers, traditionally used in food service applications. Sanitizers are traditionally left on a surface that is then air dried. We commonly see food service sanitizers left to dry on dishes, and then we use those dishes and consume food off of that plate without any concern of residual. Sanitizers traditionally work within 60 seconds of connecting with a surface. And again, sanitizers are not for healthcare applications and not traditionally used for most actual applications outside of food service. Now that we've talked about cleaning and sanitizing, we now step into disinfection. Disinfection traditionally is associated with a 5 or 6 log reduction of microorganisms on a surface. That means it kills 99.9999% of organisms on that surface against those organisms that's been tested. That may seem like a small change between sanitizing and disinfecting, but the reality is 6 million organisms can fit on the end of a pin. And as such, those extra log reductions do actually matter. The problem with disinfectants is, unlike a sanitizer that may only take 60 seconds, disinfectants traditionally take up to 10 minutes, which isn't realistic for most individuals in most facilities. As such, new technology has recently been pushed into the market that can create a more realistic time frame for everyday consumers to properly disinfect. There are a wide range of actives in the disinfectant categories, and we'll talk a little bit about those in the coming slides. The last thing about a disinfectant is because the activity level is significantly higher, many disinfectants do require a rinse post-application, while others can be allowed to air dry on the surface. It's important to pay attention to that label though, to understand proper application of a disinfectant. Some common identifiers of a disinfectant may be the dilution rate to produce that disinfectant. Some are ready to use and some can be diluted and still disinfect. The actual pH, is it neutral, is it alkaline, or is it acidic? Then you get into fragrance and color, which don't have any benefit to the actual performance of the product, but may be a characteristics that you appreciate. You will also want to pay attention to what the active ingredient is and how it works. And one thing that most people haven't paid attention to in the past, but should be paying attention to today is what is the kill claim that can be made on that product. Kill claims are going to be on the back side of the label, although not all kill claims can fit onto a quart bottle. As such, there are master labels and additional literature that should be reviewed when you're considering, does this product actually do what I need it to do? Again, we identified that there are a wide range of actives. Bleach, peroxide, and QUATS make up a majority of what we are going to see out in the market today. Bleach, or sodium hypochlorite, is very effective. It's pretty inexpensive. It is an oxidizer, so it does have the ability to kill spores if it is at the proper dilution and approved by the EPA. But it can be hard to work with, and as we all know, bleach can ruin your clothing as well as create other issues. The biggest problem with bleach is it's very unstable. If you have bleach and you've had it on your shelf for 6 months, the activity level has gone down dramatically. So it's important to test your bleach if you're using it for disinfecting. The next active that we commonly see is hydrogen peroxide. Hydrogen peroxide is also very effective. It can be effective very quickly on certain surfaces. It's known to be very environmentally friendly. It has the ability to kill quickly. Traditionally, it is not a one-step process, although newer peroxide disinfectants can clean and disinfect in one step. The biggest problem is that it's very unstable. Just like bleach, if you have a peroxide disinfectant that's been on your shelf for a while, it may not be at the current activity level that it was when it was originally produced or approved for disinfection. So it's important to check your ppm level of a peroxide. The last category are quaternary ammonium compounds, or QUATS. These are the most common in our industry. These are very effective on a wide range of surfaces. They are very, very stable, which is why they are so prevalent, because they can be used 8, 10 months, 11 months after it's been produced and still show enough activity to actually disinfect. While bleaches and peroxides in that same time frame would not be nearly as effective as they were when they were first batched. They're relatively low cost. Because of their stability, they can both clean and disinfect in one step. But please do always pay attention to your label. As we mentioned, disinfectants require a certain amount of time wet on a surface to work. If you don't follow those directions, you will not get the effectiveness that you think you're getting. Most people spray and wipe a disinfectant, or they'll use a cloth to wipe on a disinfectant. If it's not wet long enough for the kill claims on that product, you will not get the effectiveness that you are looking for. So pay attention to what your label says. On any label on the back panel, you'll have directions for dilution, dwell time, and a whole host of other directions. On the front, you'll have that active ingredient. Now, in this example here for Husky 814, you'll notice that it can kill norovirus or norovirus, a small non-envelope virus, in only 30 seconds, while others may say 10 minutes. You'll notice that this product identifies that only 0.21% of the actual formula is used in the disinfecting process. It doesn't mean that 99.79% of that product is water, but those other ingredients that are listed do not actually disinfect. And so as per the EPA's direction, those would be considered inert ingredients. Pay attention to your label. The biggest issue that we see are people that don't realize that their disinfectant requires 10 minutes. They spray, wipe it off, and ultimately leave surfaces prone to spreading of pathogens. Now that we've talked about different terms that we're seeing in the market, as well as the different types of ways that you can remove those pathogens, let's talk about what's happening today. COVID-19 is an illness that's spreading rapidly around the world. It is caused by a virus called SARS-CoV-2. Similar to SARS, MERS, and other beta coronaviruses, this virus does spread very easily. It spreads through droplet, and while it is considered an envelope virus that is relatively easy to kill, that doesn't mean that it can't spread easily. It is transmitted through droplet, as we mentioned, and it can exist on hard surfaces for a period of time, which makes proper disinfectant very important. Just like other beta coronaviruses, COVID-19 does cause respiratory illness. It does cause fever, shortness of breath, and the biggest issue is that it can lead to pneumonia in the lungs, which can be very deadly. In order to put the outbreak into perspective, we wanted to compare it to the most recent rapid outbreak that occurred in the United States, H1N1. In 2009, this virus hit the stage and caused massive disruption and was very dangerous. Both of these viruses are large envelope viruses. They both cause fever, shortness of breath, cough. The difference being that this COVID-19 does take longer to show its effects than what we traditionally associated with H1N1. They both spread through droplet. There is unknown stability of these, though we have seen journals identify between 4 and 7 day stability on hard surfaces. The main difference is the scope. While we have seen 105 cases confirmed in the world, this is still minimal relative to other viruses and the illnesses that they cause around the country, especially relative to H1N1. When we compare it to the statistics that we're seeing, these are statistics produced by the World Health Organization, not news outlets. We have 472 cases confirmed in the United States. To put that in perspective, H1N1 through its height saw about a little over 60 million people infected with the virus. The main difference as well is that while COVID-19 shows to be most dangerous for those over the age of 65 or those with preconditioning health conditions, H1N1 actually affected mostly healthy people, which made it significantly more concerning for most. 80% of those who are affected by H1N1 were actually under 65 years old if you consider the severe cases. Again, to put it in perspective for the timeline that we're seeing, not to make any assumptions, but to show how these outbreaks have occurred. The first case obviously occurred in China in late December of COVID-19, while H1N1 did occur in April. Immediately thereafter, the World Health Organization put out a public health emergency. Pandemic has just been announced for COVID-19 in a similar timeline to H1N1. Activity for H1N1 did slow about 30 days later. Most people identify the middle of July as the time at which that virus did start to slow down in its spread. And by the end of August, we had actually seen the end of the pandemic per the World Health Organization. Vaccines then came thereafter, a month after the pandemic was considered completed or the end was officially announced by the World Health Organization. And so here are a couple additional identifiers. So we aren't making any assumptions, but we think it's good to put perspective around other outbreaks that have occurred more recently that are both envelope viruses that spread through droplet form. It's always good in times of concern to know who to trust. Our suggestion is to follow the World Health Organization, who have a very useful website that update their numbers daily. These figures were found yesterday, March 10th, and identified that 472 cases had been confirmed in the United States. Again, these figures are updated daily with a very nice report that can help you to understand what the scope of the outbreak looks like. To put that in perspective without naming media outlet names, we had the same day a report that over 1,000 or nearly 1,000 cases had been contracted and confirmed, with significantly more deaths associated with the virus. We identify this because when there is concern, having the right source is maybe not the media, but the World Health Organization when you're looking for these statistics. Now, we realize it's spreading. It is a concern. Now, because it's a new pathogen, a lot of people have the question of what do I use? And the EPA and the CDC saw that need a couple years ago. And so what they did is they put out the emerging pathogen compliance. In order to understand that compliance, though, you need to first understand the Spalding classification. The Spalding classification identified that different microorganisms are harder to kill than others. And what it did was it put on a list those viruses, bacteria, and fungi and where they fit into the most difficult to kill. When we're talking about a coronavirus, including COVID-19, we're traditionally talking about lipid viruses, which would be on the bottom of the scale of the most difficult to kill, meaning that it is the easiest to kill relative to the other types of organisms. That's important to understand as we get into what the emerging pathogen compliance guidance is that the EPA and CDC produced. The EPA and CDC a couple of years ago put out what we call the Emerging Pathogen Compliance Guidance. This utilizes the Spalding classification to create assumptions for when new organisms like SARS-CoV-2 present themselves so that we can make assumptions as to what disinfectants to use to confidently believe that we are killing that organism on hard surfaces. The Emerging Pathogen Compliance Guidance helps us to buck concerns of what to use and why. And the guidance is created through a very conservative set of assumptions. If you can kill something that's more difficult to kill than the emerging pathogen, then we can assume that it can kill this emerging pathogen. So how that works in our current situation is that a new envelope virus, in order to make the assumption that you can kill COVID-19, the original registrant had to submit to the EPA for them to stamp that you have claims against a large or small non-envelope virus. So an example, a real-world example would be COVID-19 being a large envelope virus. You need to prove to the EPA that you have a small non-enveloped or large non-enveloped virus claim, like norovirus or adenovirus. If this emerging pathogen had been a large non-enveloped virus, you would need to prove that you have a small non-enveloped virus claim. And then if you do have an emergence of a new small non-enveloped virus, there is nothing more difficult to kill in terms of viruses. So the Emerging Pathogen Compliance Guidance would tell you to use a product that has two small non-enveloped virus claims to make the assumption that it can also work against this new emerging small non-enveloped virus. In the end, the Emerging Pathogen Compliance Guidance allows us to have comfort that what we're using works as long as we have followed in the product that you are using has the appropriate guidance in the master label, has been approved by the EPA to kill something that is more difficult than what we're considering here today. Here we have two examples of emerging pathogen compliance guidance from master labels from two of the largest disinfectant manufacturers or producers in the country. On these sheets, you will show that in order to kill an envelope virus, for the example on the left, your product has a human rotavirus, rhinovirus, hepatitis A, polio, or canine parvovirus claim. The example on the right identifies that it can be used in the presence of an envelope virus because it has an enterovirus D68 claim and a feline colicky claim. These are just two examples of products today that have claims that should make us feel confident that we can assume they're going to be effective against COVID-19 on hard, non-porous surfaces. Canberra Corporation takes great pride in being ahead of the market in terms of technology. In these types of situations, we're happy to have options that we feel take on these concerns best so that we can help to mitigate concerns all around the country. The three top options that we have and suggest for use in this environment are our Husky 814 QT tuberculocidal spray disinfectant cleaner, our Husky 824 Quick Care disinfectant, and Husky 892 Arena Plus disinfectant. The first product, Husky 814, is a ready-to-use formula with emerging pathogen compliance guidance in only 3 minutes or less. The next two, Husky 824 Quick Care disinfectant and Husky 892 Arena Plus disinfectant, are both concentrates, dilutable at 2 ounces per gallon to achieve the emerging pathogen compliance guidance for COVID-19 in only 5 minutes. Again, no one can claim that they have tested against SARS-CoV-2. But using the emerging pathogen compliance, CANBERRA is able to make the recommendation that these three chemistries can not only adhere to that guidance, but do so in less than the traditional 10 minutes, which we again feel is more realistic and thus produces a safer, cleaner, healthier environment for our patients, for our students, for our residents, and for our customers. Thank you for your time. If you have any questions, please do let us know, and we'd be happy to help you. We realize that this is a concerning time, and we're here for you. Thank you.